evening. My name is Angelica Santiago. I'm the admissions officer here for the online programs, specifically with the OPAL applied programs for online learning at Johns Hopkins University School of Public Health. This program presentation will be focused into our certificate in global tobacco control. Your presenters will be myself as well as Joanna Cohen, who is the director of the Institute for Global Tobacco Control. My name is Angelica, so as you can see here, I am the admissions officer for the programs. I have been in higher education for the past 5 years, specifically working with the Bloomberg School of Public Health for the past 3 years. It's an honor to get this program started with our first class start this coming fall. Joanna, can you please introduce yourself to our audience?
Hello, everyone. Good morning, good afternoon, good evening, wherever you may be. My name is Joanna Cohen, and as Angelica said, I'm the director of the Institute for Global Tobacco Control and a professor in the Department of Health, Behavior, and Society at the Johns Hopkins Bloomberg School of Public Health. I'm also deputy editor of the journal Tobacco Control, which is where a lot of the top-rated applied research in our field is published.
Thank you. So to set everyone up with an agenda, we'll be going over, and Joanna will be covering for us this evening, tobacco control, giving us a brief introduction as far as an understanding on how to help fight the worldwide tobacco epidemic. She'll be going over program details for the certificate, going into details as far as the curriculum, so you understand a little bit more about what you'll be experiencing and the skill building that will be involved with our program. So also touch base on the online learning aspect, what you can expect if you are involved with online learning here at the university, and give you some details on the faculty, the world-renowned faculty that are involved in this program. I'll then touch base and give you details on the application process, scholarships for this program, as well as financial aid details, and then cover a little bit of the admissions requirements. Throughout the presentation, if you have questions that come to mind, feel free to go ahead and type them right into the chat box. We will be making time at the end for a Q&A session and having myself cover admissions questions and Joanna cover any questions regarding the programmatic details of the program. So again, thank you for joining us, and feel free to enjoy the presentation.
Terrific. Well, let me get started. And I'll just mention that this is a really exciting area for me. I've been involved in tobacco control for over 20 years now, and I still get excited every morning about what I'm going to do during the day and the impact that we can have. So one of the reasons why it's such an important field of work and so important to be able to accomplish change is that, unfortunately, tobacco causes an immense amount of death and disease worldwide. So it's known as a key preventable cause of death in the world, and the numbers from tobacco-caused deaths and deaths is, they're staggering. I just had a terrific month because 3 weeks ago I was at the annual meeting of the Society for Research on Nicotine and Tobacco. They had a 3-day conference here in Baltimore. And then last week I was at the World Conference on Tobacco or Health. That was held in South Africa, and maybe some of you were there. And that's held every 3 years. And so to have both of these conferences back to back with the Society for Research on Nicotine and Tobacco, really spanning the area from very basic lab-based research all the way up through epidemiology and policy, with a predominantly U.S. focus, and then going to the World Conference with over 2,000 delegates and people delegates there from over 100 countries. I learned so much about interventions that are happening in countries that I hadn't been aware of. It was just a really rejuvenating and exciting experience for me, and I really enjoyed it. So again, this is a field that keeps us on our toes, keeps changing, and it demands, creative, passionate people who care about public health and want to make a difference. In this slide, one of the bullet points talks about the tobacco industry, and of course, as many of you probably know, that's one of the key challenges that we have in trying to improve health. It's hard enough to get people to change their behavior to become more healthy, but it's even more difficult when you have an extremely well-financed multinational industry that fights you every step of the way. So that's certainly, an issue that we're going to be covering in the program, and is part of our day-to-day life, trying to deal with the industry. And of course, the great thing in tobacco control is that we have a set of evidence-based policies and other interventions that are proven effective, that they're codified in the World Health Organization's Framework Convention on Tobacco Control, that has been ratified by over 180 countries. So we know a lot of what needs to be done. One of the challenges is ensuring that these policies and interventions are not only enacted, but also implemented. So as I'll mention shortly, we have one of our courses in the certificate program focuses on implementation, which is so important. And then the last point on the slide, maybe this is more relevant currently in high-income countries, but the idea of tobacco regulatory science, where governments are thinking not just about the host and the environment and the vector of disease, but also the agent of disease, and in this case, it's the tobacco product itself, and what we might do to reduce the addictiveness and attractiveness of the tobacco products. So I'll just move on to mention, talk a little bit about careers in the tobacco control field. And this is an area that continues to be looking for the best and the brightest. In my experience, there are a lot of opportunities for people with experience and expertise in tobacco control, and particularly those with skills that they can apply to the field. So there are all kinds of potential employers for those who have training in tobacco control. Governments are one of them, whether it's federal or national governments, state or provincial governments, and even local governments. Many of the cities in the U.S., and I know in other countries as well, they have their tobacco control office, and they're, at the city level is where a lot of innovation takes place. So at all levels of government, there are opportunities. There are opportunities in non-governmental organizations, including in the World Health Organization and all of its affiliates at the regional and country levels. And then, domestically here, with the Food and Drug Administration, with its relatively new Center for Tobacco Products, is continuing to ramp up their personnel and continues to advertise for positions there. So we have a list of possible job titles that governments, NGOs, the FDA and those types of regulatory bodies would be advertising for. And it really is a whole range. With investments in tobacco control, both, through philanthropists, through governments, through dedicated voter-initiated taxes, there are, and in the case of the U.S. and the FDA, through user fees on tobacco companies, there are, certainly funds available to support these positions. So the bottom line is there are a lot of opportunities for people with this training. So let me get into some of the program details, and this is a one-year certificate program. You get a certificate, from the Johns Hopkins Bloomberg School of Public Health, and this is based on the certificate program that we have done and have experience with for many years. Now, with this OPAL program, it is 100% online, and it's part-time, which we feel is going to be much more convenient for the types of professionals who might be interested in doing the certificate. Because it's part-time, you can still work at your current job and have the opportunity to get through the courses at your convenience, although with a term schedule. And the online, having the program online means you can do it from the comfort of your home or your workplace or wherever it's comfortable for you. So the certificate program is divided into 4 terms. There are 4 8-week terms. And so it goes through almost a full calendar year or a full academic year. And you'll be taking 2 courses per term. So that's 8 courses altogether. And then there are a couple of sort of introductory courses that you would need to do just to allow you to be, give you the skills to be able to take the rest of the courses. The program and the OPAL program is really based on applied learning, and in tobacco control, that really is our bread and butter. We're very applied in everything that we do. So you'll be learning skills, the knowledge, but also the skills that are needed to do the jobs that employers are looking for. We have the goal listed at the bottom of the slide, and really we want the purpose of this program is to provide professionals with the technical skills that are necessary to develop and communicate the evidence that is required to support tobacco control policy enactment and implementation. And we'll go over, actually, maybe we'll go to the next slide to look at the specific courses. So as you said, the prerequisite is an introduction to online learning, just so you know how to use the system. And then we have the 4 terms listed with 2 courses per term. In the first term, there is also an academic and research ethics course that all graduate students at the Bloomberg School of Public Health are required to take. So we cover really a range of topics that give you the knowledge and expertise both at the domestic and at the global level. So we start with a global tobacco control course and a strategic communications course, because being able to communicate strategically is really important, well, for any position, but also for advocating for effective tobacco control interventions. And then in the second term, you would take a course on tobacco regulatory science, really looking at how governments can what they can do, as I had mentioned previously, to regulate the product itself and reduce their addictiveness and attractiveness. And we have, obviously, many of you might know that the Food and Drug Administration here in the U.S. has, has the authority to regulate tobacco products, but other countries have taken action as well, including countries like Brazil and Canada and the European Union. So there are a lot of great case studies to draw from. We also offer in the second term a leadership program, because leadership is so important in any position, and both in terms of leading change and developing a vision for the future, and understanding the process of effectively working with others and leading others. So that's what we cover in the leadership course. And then you move on in the third term to become familiar with quantitative methods that are useful for tobacco control. So there we cover things like study design, things that you might, studies that you might design to develop evidence for tobacco control, tobacco control interventions, or to evaluate them as well. There's also a professional writing workshop course. Being able to express yourself in the written form is really essential. So that's covered, and important skills there. And then in the fourth term, we cover qualitative methods for tobacco control. So things like observations, which are really important, for example, to assess compliance with policies. We cover focus groups, long interviews, and one of the unique sort of forms of qualitative methods for tobacco control is being able to search through, find, and analyze tobacco industry documents. So there are vast collections of industry documents that were released through litigation efforts, and those are really valuable sources of information for tobacco industry strategies. And the final course on the list, last but not least, is implementation of tobacco control policies and programs. Implementation is so key. You can sort of pass a policy or have the full plan for another kind of intervention, but if you can't implement it properly, you're not going to have the impact that you're hoping for. So the implementation course is really important and very applied as well. So maybe then I'll just we'll move on to just tell you a little bit more about the program. And the Institute for Global Tobacco Control at the Bloomberg School of Public Health has been around for many years. And as I mentioned, we've been running a certificate program as well for a decade now. So we have lots of experience in developing and developing the curriculum and delivering it, and working with students to meet their needs for the workforce. And again, as we've said, it's online, so you'll be very flexible in terms of you'll be able to juggle both a job as well as being able to get through the 2 courses a term. And there is a 24/7 help desk for any issues that you might encounter. So I think we have great faculty, who have a lot of experience in tobacco control and are very passionate about the topic as well. So we have a listing here of the instructors for the different courses. These are all faculty at the Bloomberg School of Public Health, and terrific people great teachers, and I'm sure you'll, yeah, it'll be terrific. We're really proud of this curriculum. And then just to say that at the Institute for Global Tobacco Control, we partner with a number of other organizations. So we're a collaborating center of the World Health Organization. We're one of the partner organizations in the Bloomberg Initiative to Reduce Tobacco Use. We've worked with the Robert Wood Johnson Foundation, with the Monday campaigns related to quitting tobacco use. So all of our work and our focus is applied and working to make a difference, and we're so excited to be able to work with you and share our knowledge and expertise and learn from you as well.
Well, thank you, Joanna, for going through all of those details, especially around the curriculum. I'm sure everybody really needed to hear a little bit more about what they could possibly experience through our program. For those who have felt connected to the materials they've been listening to, I'd like to go over some admissions requirements and talk you through the admissions process for the program if you're looking to move forward. Applications for this program are processed through SOFIS Express. SOFIS is a third-party application portal for all public health schools, so it helps to streamline the application process for all your documents. Students are required to have a completed bachelor's degree from an accredited college or university, provide a resume or CV of their experiences, and 3 letters of recommendation. Those recommendations are processed through the application portal. So you request them electronically, as well as those recommendations can be a variety of professional as well as academic references. So this will look different for all candidates based on their background and where they are in their career. Part of this, when you are going through and writing statements, answering essay questions, is being able to demonstrate your interest or involvement in the field of tobacco control. So you'll have opportunities in the application portal to upload a statement, to express your interest and explain some of your involvement as well as your experiences in the field of tobacco control. For our international students, they'll have an opportunity to go through proficiency in English through some of the essay writing and some of the questions in the application, and are required to get a course-by-course evaluation done through the World Education Services. Now, to go through a little bit of the details for the financial aid of tuition for the OPAL certificate, for this particular certificate. The 2017-2018 tuition was $1,091 per credit hour. Our OPAL scholarship does cover $419 per credit, which leaves students responsible for $672 per credit. That scholarship is particular to the certificate itself. So for all students, that scholarship will be awarded. The scholarship listed below is a scholarship that does reference full tuition coverage, and that is particular to applicants from certain regions. So if you need particular details, if your country is listed or where you live is listed as an applicable country to apply for this full scholarship, please be sure to email us directly. I will be providing more details as far as how to get in touch with myself directly for one-on-one questions. The admissions application does serve as a scholarship application. So outside of applying to the program, you don't have any additional forms to fill out for those scholarships. We'll also provide you, if you need information on financial aid, we'll provide information regarding federal and private loan processing as well through our admission services. Now, to discuss the admissions information, our applicants are reviewed on a monthly basis. So we do encourage students, as soon as you have decided that this program is the right program to move forward with for your career and your personal goals, to make sure to go through the application as soon as possible. Application deadlines do vary based on scholarship eligibility. For those interested in applying for the full scholarship, the IGTC scholarship, applications do have to be submitted by April 1st. You do not have to have any WES credential evaluation submitted by then. That would be done afterwards, but you do have to have the other components of the application submitted by April 1st. All other applicants and those interested in pursuing the OPAL scholarship for the program would have to submit an application by July 1st of this year. This program will enroll students one time per year. And right now, the academic term that we are working towards is the fall of 2018-2019 school year, and classes will begin on September 4th, which is a Tuesday. So now we're going to open up for a little bit of a Q&A session. If you have questions that are particular to admissions, I'll be happy to answer them. And any questions that are particular to the program, Joanna will be happy to go over the details. Joanna, I think this would be a great opportunity for you to answer a question. We had one come in. If you have any set up alumni networks or examples of where some of the alumni from previous programs through tobacco control are now, where they're employed now.
Yeah, so we do have actually alumni network. So that this is for our alumni of our certificate program, but we also do a range of in-person leadership programs as well. And everyone signs up to be part of the network following completion of their program. So it allows people to find other alumni within their countries or their cities, and or within their regions, who've been through the program in previous years. So it's a terrific networking opportunity. In terms of positions, a lot up till now, it's we've been offering the certificate program with the full IGTC scholarship for people who have already been working in the field particularly from low and middle income countries, and have been interested in just gaining more expertise. So we don't have a full listing of, a lot of people have stayed and been able to progress within their position or move to other organizations, but I don't have a full listing of the specific job titles and employers. And of course, when you cover lots of countries, the specific employers within each one are going to vary, of course. But we've had people who had worked in academia, in non-governmental organizations. We've had journalists come through the program. We've had folks associated with governments as well. So a whole range of people have done the curriculum as of now.
Perfect. No, thank you. I think that was very detailed and gave a good perspective on the alumni setting and the opportunities for connectivity after the program. Another question came in, and the student said that they wanted to confirm there was not an English proficiency test, which I'm happy to go over and answer. For the application process, students are not required to take a TOEFL or an IELTS English proficiency test. English proficiency will be demonstrated through the application, as you do have to write a statement of interest to articulate your interest into the program and demonstrate involvement. So there is not a separate official test for English proficiency. Joanna, I did have another good question that I think you could help bring some insight to. A student said that are you looking for any specific career background, or if there could be any examples of involvement in the tobacco industry that you are looking for from a candidate?
Well, the great thing about the tobacco control area is it is multi-sectoral and multidisciplinary. So really, no, I would say, there's so many backgrounds that that people can bring a lot with the background that they have and the experiences that they have and make important contributions. So yeah, there's not one kind of person. I think we're looking for the some passion and interest in the field, and people are going to excel at different things. Some people might be more numbers based, and some people might be more qualitative based, and some people might be more interested in the product itself, and some people might be more interested in preventing kids from starting to smoke, and others might want to be helping smokers quit smoking. So there's a whole, there's so many facets of the field, and therefore so many different disciplinary and sectoral backgrounds are important. So I think just be yourself. We look at just your interest and what you might bring. I mean, please be aware that these are graduate level courses at the Bloomberg School of Public Health. So they are rigorous courses. You do have to put in the time, and there are assessments. You get a grade, and for the at least for the IGTC full scholarship, if you don't maintain a certain grades, then unfortunately you are not able to continue in the program. So you do have to be prepared to work hard, but we are looking for all kinds of people and what they can bring to the field.
Thank you. I am going to go ahead and take the presentation back to the tuition information page. There are several questions coming up around the scholarship that I'd like to help clarify. So there is a full tuition scholarship available, which Joanna referred to as the IGTC scholarship. That scholarship is particular for students from certain regions, low and middle income, from certain low and middle income countries. And of course, if you have questions and to reference, if your country is listed within that, you can always feel free to contact me directly afterwards. However, the full scholarship is particular to candidates from low and middle income countries. The Opal Scholarship is awarded to all other students. So if you are admitted, the scholarship is particular to the program, you would automatically receive the Opal Scholarship. So those students could plan for the $672 per credit, which over the 25 credits of the program would be about $16,800. So that is the full amount of the tuition. And just as a reminder, there is no additional applications for either the scholarship, or the IGTC scholarship, or the Opal Scholarship. There's no additional forms to fill out. It's just the date by which you would apply. For the IGTC scholarship, you would want to make sure your application is in by April 1st. And for those students, you would need to submit your unofficial transcripts or copies of your school records in the application portal. You do not have to complete a WES evaluation or any official credential evaluations until after you would be admitted. And I am going to go over just one more question that we had around the admissions process. The 3 letters of recommendation are subjective, so they can be from academic references, they can be from professional references, supervisors at your work if you are part of different organizations, colleagues from those organizations, directors from those organizations. It'll be different for everybody. but you would just want to make sure it is a professional reference or an academic reference. So you just can't be a personal reference letter. I think this is all the time we have for this evening. Joanna, I wanted to thank you for presenting. Did you have any final thoughts that you would like to share with potential students for this program?
Yeah, thanks, Angelica. I think we're just excited to be offering this and on the full online format. It's always we always look forward to reviewing the applications and seeing all of the outstanding people who are interested in this field, and please do reach out if you have any questions whatsoever. I know in some, it can be, there's a lot of information here, but we're happy at any point to answer whatever questions you have. So thank you, and I look forward to seeing you all in the fall.
Thank you so much. And just for anybody who is interested, there is 2 different QS scan codes here on the front. The one on the right, if you are ready to start an application, if you take a picture of it, should lead you directly to Sophus Express through a mobile device. And on the left, it is to be able to look into the website for additional details on the program. Please also take note, if you would like to, there is a phone number for my office as well as my direct email. There were a few questions that came in that were a little particular to your background. I want to make sure to answer those. Please email me directly, and some individuals I'll be following up with personally after our presentation. So thank you so much, everyone, for attending our first virtual open house for this program, and we will look forward to the start of your applications and the first start for this program in the fall. Have a great evening and a good day, and thank you so much.